I'm Dr. Patrick Schumacher, one of the ophthalmologists here at Eye Specialists. And one of the most common questions I get asked is, what is a cataract? The cataract in reality is just the lens in the eye getting cloudy. In the front part of the eye we have the cornea, or clear windshield of the eye. Immediately behind the cornea is the iris that gives the eye its color. If you look through the pupil, or immediately behind the iris there, is the lens. Just like a lens in your glasses, when you're born it's clear. Over the years and for certain other reasons, the lens can become cloudy, and that just obscures light going through the pupil from focusing on the retina. When we do cataract surgery, we make tiny incisions in the cornea off to the side to get at the lens, and the lens is physically removed from the body. When we remove the lens, we always implant another lens into the eye, and they come in different strengths. So we have a choice to make, and when we put that lens in there, we can either shoot to make you see as good as possible at a distance or up close. But we can't do both. In fact, the better we are at doing one task, the worse the other will be. 9 times out of 10, patients in this practice choose to be corrected for a distance, and then we explain to them that they will need reading glasses or maybe even a bifocal to see up close. Patients with a lot of astigmatism, which is just a warpage in the cornea such that it's not round, they may need glasses even for distance because the astigmatism can stick around after the surgery. There are some newer lenses that are implanted into the eye, just like the old-fashioned ones, that correct both for a distance target and for a near. In other words, give the patient some depth of focus. However, if patients have certain complications or if they have certain diseases in the back of the eye or a lot of astigmatism, they may not be a good candidate. They would need to discuss this with their doctor. Those lenses generally are not paid for by insurance. The second most common question I get from patients is, are my cataracts ever going to come back? And yes and no. No, the cataract is thrown out at the time of surgery and it will never return. However, you can develop a film growing across the back surface of the lens. The reason why is we don't completely remove the lens at the time of surgery. We leave the clear wrapper we call a capsule in place, and the man-made implant is inserted inside of that capsule. Over time, some of the living cells from the lens can grow across the back and make it hazy. From the patient's point of view, it would seem like things were getting a little cloudy, kind of like the cataract was returning. But in reality, it never does. To fix the second problem, we simply take you to the surgical center and use a laser focused on the back surface of the lens or the capsule and cut a circular window in that capsule. When the flap of tissue falls back, the patient can see clearly right through that hole, just like the day after the lens was implanted. Once that's done, the odds of it returning are almost zero. And again, I'm Patrick Schumacher, one of the ophthalmologists here at Eye Specialists.